Let's look at the picture across Canada now. More than 1,400 people have died from COVID-19. Confirmed cases have now surpassed 33,000. More than 500,000 tests have been done, with 6% of them coming back as confirmed cases.
Dr. Tam said that there is some cause for cautious optimism coming from the data. This still holds true. But we must remain vigilant, stay focused, and keep our eyes on the ultimate goal, which is limiting the spread of this terrible virus.
Most of the deaths in Canada are in Quebec, inside long-term care homes. Quebec's premier has described the situation as a national emergency. And tonight, the province is receiving help from the federal government. As Dan Spector explains, members of the Canadian Armed Forces are now coming to the rescue.
A surreal but welcome sight. Members of the Canadian Armed Forces are now deployed to a public long-term care residence in Montreal.
People were clapping. Listen, this situation is so dire that people need help.
Lieutenant Commander Heather Galbraith is one of 100 Canadian Forces medical personnel fanning out to Quebec seniors' homes. She's a trained family doctor who grew up in Sudbury, Ontario.
We are essentially doing what we call in the Army and Navy and Air Force a recce, so a reconnaissance of what needs are required.
This is the second seniors' home the force has assessed. The Centre d'Hébergement Yvon Brunet has 105 cases of COVID-19, more than half its residents.
Even if it's the Army or doctors or anybody, I'm happy there's some help there.
We have training packages that are being rolled out. A lot of that will be learned on the job as well.
So far, the forces are focusing on 5 residences in Montreal, but the needs are widespread.
Malheureusement, on a plusieurs d'entre eux qui sont malades.
Unfortunately, many of our staff are sick. They have COVID-19, says this health official. Crews in long-term care facilities can't keep up with demand to deal with some basic needs of seniors, like feeding and changing diapers. Canadian soldiers are stepping up.
Absolutely. Our teams will do whatever we can.
And there's another type of reinforcements on the way to Montreal's seniors' residences, specifically those in the western portion of the island.
We're training our new staff, volunteers, and other people, anyone that volunteered really.
Health authorities in Montreal's West Island have partnered with the Red Cross to give volunteers crash courses to help out in seniors' homes.
Power of humanity that we usually send outside of Canada to countries that are really in deep needs. Now we are bringing it home.
They have the capacity to train 40 people a day. Part of this hotel has become a makeshift training center. Officials hope lots of people will turn out because the battle is far from over. Dan Spector, Global News, Montreal.
Concerns at an Alberta long-term care home have prompted the province's health authority to take over its operations. Alberta Health Services is now managing Manoir du Lac, a care home about 4 hours northwest of Edmonton. At least 26 residents and 11 staff have tested positive for COVID-19. 5 residents have died. Alberta's Chief Medical Officer of Health says the province took over because of several concerns, including inadequate screening, a lack of staff, and failure to meet care standards. Family members with loved ones in the home were surprised to learn about the problems.
It's not a good situation, to be honest, and now a lot of the other staff are in jeopardy, and the residents especially, and hopefully things get taken care of.
The company that was managing the care home says it was following protocols to the best of its ability. Meanwhile, Ontario reiterated it has no intention of taking over care homes that have COVID-19 outbreaks. Instead, the province is coordinating plans with the facilities. With every announcement about changes to the financial programs rolled out in Ottawa, we hear about thousands of Canadians who are left out. Abigail Bimman tells us about the changes some people are calling for and why help is so badly needed, especially among the nation's most vulnerable.
Walter Cole was already homeless. Then he lost his job as a cleaner due to COVID-19.
I'd like to go back to work.
Life for him at the Ottawa Mission shelter has changed. New rules around cleaning and trying to enforce physical distancing, not easy among the homeless. Cole is not worried about getting sick.
Not one bit, because you know why? All 3 shelters, nobody's got it, so and this place is so clean.
But fear keeps staff on high alert.
Every call it's, uh-oh, is this the one? Is this the first positive test? Because we know we're in an enclosed environment and what a risk that would bring.
Peter Tilley says some of the $200 million promised by the federal government for the homeless has trickled down to his shelter, but more is needed. And the homeless are just one vulnerable population.
We're hooped. It doesn't matter which way you look at it. We are absolutely hooped.
Sue Beatty was laid off due to COVID-19, so she would be eligible for the CERB. But like thousands of Canadians, she's worried if she applies, she'll lose her provincial disability benefit. BC was the first province to be clear it wouldn't do that.
It's so wrong on every single level. It seems everybody except the vulnerable are being looked after. And it really should be the other way around, or at least equal.
You could well see a dollar for dollar clawback. So you could apply for CERB and then realize at the end of the month that your disability payment you thought was going to be $1,000, $1,500 is now zero because you applied for the emergency benefit.
The Canadian Centre for Policy Alternatives has been tracking who falls through the cracks. Even with this week's expansion of the program, Dave McDonald says there are about 800,000 Canadians who can't get the CERB or EI. And he says youth were hit especially hard.
A third of all youth that were employed in February either lost their job or lost the majority of their hours in March.
Shaylin Harnish is behind this petition to expand the CERB to include students and new graduates. The single mom and full-time student has no idea whether she can afford to go back to the classroom this fall.
We feel left behind and we're looking for support. If we could work, we'd rather work, but we can't.
With millions of Canadians feeling the same way. Abigail Bimman, Global News, Ottawa.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.